Gentlemen, that box of baking soda sitting in your kitchen right now is probably being used for one of two things: baking or absorbing odors in your refrigerator. But what if I told you that its true power has been completely overlooked? When you combine this simple white powder with one specific oil, you create something remarkable. A topical treatment that ancient healers used for thousands of years to fight inflammation, ease chronic pain, and support male vitality. My name is Dr. Mika Hayashi, and I've been a practicing urologist for over a decade, helping men reclaim their strength and their intimate health. That specific oil I'm talking about is castor oil. And today I'm going to show you the science behind why this ancient remedy works, the exact 2:1 ratio you need to create it. 7 powerful ways to use it specifically for men over 50. And a simple 10-minute test you can do tonight to feel the difference immediately before we dive in. If you're serious about taking control of your health naturally, type "ready" in the comments below. A forgotten remedy worth rediscovering. When I first learned about castor oil in medical school, it was barely mentioned. Just a footnote, something old-fashioned, something associated with home remedies and grandmother's advice. But years later, when I began focusing deeply on men's sexual health, I started revisiting these overlooked remedies with fresh eyes. And what I found left me genuinely surprised. Not because it's trendy, not because it's expensive, but because it works. And more importantly, it works in a way that modern medicine often overlooks. Why castor oil is so unique. Here's something most people don't know. Castor oil doesn't just sit on your skin like most oils. It penetrates. It travels through layers of tissue, carrying active compounds deeper into the body. Instead of just warming the surface, it works beneath it. For men over 50, this is incredibly important, because one of the biggest hidden issues behind declining performance isn't just hormones. It's reduced blood flow and tissue stagnation in the pelvic area. The science made simple. The secret lies in a compound called ricinoleic acid. This fatty acid makes up nearly 90% of castor oil. Now, don't worry about the technical terms. Let me simplify it. Inside your body, you have tiny receptors, like switches, that control inflammation and pain. One of these is part of a system called prostaglandin signaling. Ricinoleic acid interacts with these receptors and helps turn down inflammation. Think of it like lowering the volume on background noise inside your body. Less inflammation means better circulation, less tissue stiffness, improved nerve sensitivity. And that's exactly what many men over 50 are missing. A real story that changed my perspective. Remember a patient named Walter, 74 years old. For 2 years, he had been struggling. Weak erections, loss of sensation, frustration. He tried supplements. He even considered injections. Nothing worked. So we tried something simple. Castor oil packs applied gently to the lower abdomen and groin. 2 weeks later, he walked into my office with tears in his eyes. He said, "Doctor, it's like something switched back on." That's the power of restoring blood flow. Some more than just circulation. Castor oil does something else that's just as important. It supports the lymphatic system. Now, what does that mean? Your lymphatic system is like your body's drainage network. It removes waste, toxins, and excess fluid. As men age, the pelvic area often becomes a place where this waste builds up. That leads to swelling, tightness, reduced sensitivity. Castor oil helps move that stagnant fluid out. It clears the traffic, so to speak. And when that happens, tissues begin to function properly again. See why baking soda changes everything. Now let's talk about the second ingredient, baking soda. Most people think of it as something for baking or cleaning, but it has a very interesting effect on the body. It helps balance pH. Why pH matters more than you think. Over time, your tissues can become slightly more acidic. This happens due to poor circulation, processed foods, stress, aging when tissues become too acidic. Inflammation increases. Blood vessels. Tighten healing slows down. Baking soda helps neutralize that acidity. And when you combine it with castor oil, you get a powerful synergy. A second story you won't forget. A patient named Ronald, 68, came to me feeling stuck. Everything looked fine on paper. His tests were normal, but he felt tightness in the groin. Weak performance. A constant sense of heaviness. He suggested trying a simple blend of castor oil and baking soda. Within a week, he noticed warmth returning. Within 2 weeks, he said something I hear often. I feel like my body is waking up again. And then one day he smiled and said, Doctor, morning erections are back. Why this combination works so well together? These two ingredients do something powerful. Baking soda softens and prepares the tissue. Castor oil penetrates deeply and delivers active compounds. It's like clearing a blocked road and then sending fresh supply trucks through. The exact method. Golden ratio. Here's how to make it properly. Ingredients. Oil 1/2 teaspoon of baking soda mix until it forms a smooth paste similar to toothpaste. Optional tip. Warm it slightly by placing the bowl in warm water. This helps it absorb better. Where and how to apply. Apply to lower abdomen, 2 to 3 inches below the navel, pubic area, inner perineum. If comfortable, these areas are key pathways for blood flow. See application technique. Take your time. Massage gently in slow circular motions for 2 to 3 minutes. This is not about pressure. It's about stimulation and connection. Then let it sit for 10 to 15 minutes. For deeper effect, cover with plastic wrap. Apply gentle heat using a warm towel or heating pad. What you might feel within minutes, you may notice warmth, tingling, relaxation. That's circulation improving. Some men also report better sleep, fewer nighttime bathroom trips. It's a subtle return of sensitivity. The key to results. Consistency. Do this at least 3 times per week. Consistency matters more than intensity. C. What to eat. After application, this is important. Right after your session, support your body with the right foods. Try this combination. Beets or beet juice boosts nitric oxide. Avocado restores hormones. Spinach with olive oil and garlic improves circulations. Dark chocolate, 70% cacao or higher. These foods enhance nitric oxide production, which helps blood vessels relax and expand. What to avoid after application. Avoid white bread and pastries, processed meats, heavy dairy, alcohol. These can undo the benefits by increasing inflammation or restricting blood flow. The final ingredient that amplifies everything now. Here's something most people overlook. Apple cider vinegar. Taken before your routine, it enhances the entire process. How to use it. 1 teaspoon apple cider vinegar. Mix in warm water. Optional. Add honey. Drink it 10 to 15 minutes before applying the blend. Why it helps. It supports pH balance, mineral absorption, circulation. Many men say it feels like turning up the volume on results. What to expect over time. Day 7. Warmth, slight fullness, better sleep. Day 14. Less tension, improved sensitivity, increased confidence. Day 30. Stronger function, better circulation, a deeper connection with your body. Safety first before starting. Do a patch test. Avoid open wounds. Use high-quality ingredients. Consult a doctor if you take blood thinners, had recent surgery, have serious medical conditions. Important reminder: this method supports your body. It does not replace proper medical care. Conditions like diabetes or heart disease still require professional attention. Your action plan for tonight. Mix the blend. Apply for 10 to 15 minutes. Repeat 3 times per week. Add apple cider vinegar before. Eat circulation-supporting foods. Track your results. Stay consistent. So, final thought. This isn't just a treatment. It's a signal to your body, a message that says, I'm not done yet. Healing doesn't happen overnight, but it does happen with patience and consistency. If this message spoke to you, don't keep it to yourself. Share it with someone who might need it. And in the comments, tell me, are you going to try this tonight? Type yes if you're ready. Type no if you have questions. I read every comment, and I'm here to help. This is Dr. Mika Hayashi, and I'll see you in the next.